Prudent Healthcare means basically providing an excellent service at the most cost-effective way, and basically making sure that we have a sustainable service.
To me, Prudent Healthcare is about working as a team, improving services, passing knowledge on to other specialities and saving money, but maybe bettering the service at the same time.
It's looking at things differently, more streamlined and more individual, so not everyone needs to follow the same pathway.
We know that the quality of healthcare could be improved, but also we have to do it within a specific financial envelope. To achieve both, we have to change the way that we work.
Whether you're a member of staff or in the public, we're all potentially patients. So we want to ensure that we have a good service for the NHS today as in the future.
I think it's high time that things were changed, because we can't go on sustaining the health service as it is. It's a nice idea to have a health service, but it's got to work, and the way it is now, it's not going to work.
For a few years now, we've had an innovative email advice line for our primary care colleagues, so they can email us with any queries they might have about investigation results or whether it's appropriate to refer people. That means that reduces the need for inappropriate investigations and also the need for inappropriate appointments.
When the referrer comes in from the GP, if we think that GP can treat the patient successfully, we will just send them a letter. We'll give them the appropriate tests to do, maybe the appropriate treatment to do. Don't need to come into the hospital. This is just how you can treat that patient yourself. And that's gone down really well with primary care.
If we had one electronic database that all agencies could share to access any information that they need about somebody's story of healthcare, it's going to speed up processes, it's going to reduce frustration.
Communication is extremely important, and something that would be great is if we could have a one point of contact for all services.
We'd like to bring in the texting service just to remind the patients to come. We'd like to bring in an email advice line where they can just email us into a consultant and we can answer them via an email, which would be much simpler for them. But it's getting past the red tape it is and allowing us to do this kind of thing, but we are trying.
I think everyone should get involved in Prudent Healthcare because it's something that's not going to happen on its own. Everyone on the ground needs to take ownership of something and enforce change.
As a member of the NHS team, I obviously want to be able to do this so I can educate my staff and my patients as well, and also my family as well, so I can give, so I can make sure that there is an NHS for my family. I'm really excited about the year ahead, anything but all about becoming a Prudent hospital, and I just can't wait to get on with it.
I'd love to have a proactive role in Prudent Healthcare, and I'd be more than willing to give up my own time because I actually believe in the philosophy of Prudent Healthcare, and I think that it's the way forward for the NHS.